Live from Eyewitness News, this is Breaking News.
Good afternoon, I'm Mike Montecalvo. Governor Raimondo giving her daily coronavirus update. Let's go live to the State House.
As we begin a new week together dealing with the coronavirus pandemic. It's a beautiful warm day out today, as it was yesterday. I hope you have an opportunity to get outside and enjoy the spring air. It's good for your mental health, good for your physical health. So I'll begin, as we always do. The numbers are going to come up on the screen. I think these numbers are a good news story. We have 175 new cases, which is, less than a little bit less than we've been having. You'll see hospitalizations are very stable and have plateaued. So that's all a good news story. It shows that the virus isn't running away with itself. We're on top of it. It's stable. We've made good choices, and we've done as well of a job as we could. Very sadly, there are 21 additional deaths. Dr. Nicole will go through the details of that. And I would just ask us all to remember the toll that this crisis is taking on so many families in Rhode Island, especially those who've lost loved ones. I want to say this. I'm going to start to give some guidance around how we think about phase one. But I just would ask everybody to pause for a half a second and think about where we are and where we've been. So we've been at this now for just about 2 months. That's something to really think about. On the one hand, it seems like we've been dealing with this forever, kind of hard to remember life pre-coronavirus. On the other hand, it's only been 2 months. And as I think about all we've done together as a community to deal with this crisis in the space of only 8 or so weeks, I have to say I've never been prouder to be a Rhode Islander. Rhode Island has really risen to the challenge over the past couple of months in so many ways. Our leaders have risen to the challenge at the National Guard, municipalities, mayors, legislators, my own team, hospital executives, so many leaders have stepped up. People in the trenches working on the ground every single day in our hospitals and nursing homes and grocery stores, often without a day off, have just kept Rhode Islanders safe and healthy. It's unbelievable. And every day, Rhode Islanders have reached out to help their neighbors in ways big and small. From manufacturers calling me directly saying, "Hey, Governor, I see you have a shortage of gowns. We think we can help," to the simple gestures of kindness, looking in on a loved one, calling someone who might be lonely, sending a smile emoji to someone who's having a tough day, delivering groceries for somebody who's elderly, and then retooling the whole way we live. So although this is traumatic and difficult and mostly has been a nightmare for all of us, I have found inspiration and courage and hope, actually, in seeing the resilience and kindness and generosity of the people of Rhode Island. And it has been why we are able to be as successful as we've been in limiting the loss of life and hospitalizations of the virus. So I want to thank you for that. I also want to give you some statistics to let you know what a good job you're doing. So as you know, I was a little worried about the weekend. It was a gorgeous day, both days. We had a lot of people out and about enforcing social distancing in our parks, on our roadways. By and large, Rhode Islanders were very compliant. Not perfect. We definitely had to break up some crowds. We had to insist that people separate from each other or put their mask on. By and large, however, you did a great job. And that should give you confidence. I want you to feel confident that if you continue to do these things, wear your masks, wash your hands, stay home if you're sick, stay 6 feet away from people, it's going to be safe to come out increasingly as we go forward. Here's another statistic. Over the weekend, the Department of Business Regulation inspected on over 300 businesses. So in unannounced visits to over 300 businesses all across Rhode Island, they reported a 95% compliance rate of customers wearing masks. And they reported nearly 100% compliance with people staying 6 feet apart, especially when they were waiting outside to get into the store. That's fantastic. If, as we go forward in reopening our economy, we continue to see that kind of compliance, everyone's wearing their mask, sick people are staying home, everyone is staying 6 feet apart, then we're going to get this economy up and running, and you can feel safe to go out again because folks will be doing what's necessary to keep you safe. So with that, I want to offer a few thoughts about what phase one of our reopening might look like. As I stand here today, looking at all the data, looking at hospitalizations, checking in this morning with hospitals, it is my hope and intention to lift the stay-at-home order when it expires on May 8th. A number of you have commented to me that that is sooner than Massachusetts, Connecticut, New York, New Jersey, and our neighbors. And that's true. But I wouldn't do it if I didn't think we were ready. On the call we just got off of with public health experts and other governors in the White House, it's clear that each governor has to look at the situation in our states. And right now in Rhode Island, we're testing the most number of people per capita. Our cases are going in the right direction. Our hospitalizations are plateaued. And I feel if we stay on this path, it will be safe under new conditions to begin a slow process of reopening on May 9th. Now, here's what I want to say. What's it going to look like on May 9th and May 10th? It is not going to look radically different than it does now. And if it does, if we start to see crowds and bunching, then we're doing something wrong, and I'll have to go back to more restrictions. Phase one, I want you to think slow and steady, patience, and flexibility. I also want you to keep in your mind, keep your network small. We want to keep our network small. We want to stay close to home, but the good news is we're going to get to start leaving our homes. And that is something that I hope gives everybody a smile on their face. It's time for us to think about coming out again in a slow and steady fashion, wearing our masks, avoiding crowds, maintaining 6 feet of distance, which by now we've become expert at. So my goal in step one, every governor's going to handle it differently. I'm focused on getting people back to work. So we've gone through in great detail who is out of work, who can I get back to work, how do we get the most people back to work as safely as possible, as quickly as possible. So to that end, we know that retailers and those employed in the retail industry have really, really suffered. Drive down any main street right now in any town in Rhode Island, the lights are off, there's the closed sign on the retailer, and we have a lot of people out of work. So in phase one, I will announce that non-critical retail stores that have been closed will be allowed to reopen their in-person operations, but with capacity restrictions, similar to what you're seeing in grocery stores now, only even more restricted. We're going to still encourage pre-ordering and in-store pickup as the best and safest option. However, we are going to enable stores to have limited in-person browsing. The number of customers allowed will vary based on the size of the store. And our commerce team, Stephen Pryor, has been doing an unbelievable job, truly, talking to retailers, talking to small businesses, listening to you, and trying to balance public health with your very real needs to reopen. So I'd ask that we could put up on the screen a visual of what the Commerce Department suggests could be the new look and feel in phase 1 for a small retailer. As you can see, the store is arranged for curbside pickup, but it also has clearly delineated a line with markers on the ground that are at least 6 feet apart as you enter. The store is also prepared for in-store pickup and browsing. It's going to be set up similar to what you're used to now in a grocery store. You have to wait outside if there's too many people in the store. You have to wait 6 feet apart. And retailers will be able to have one person browsing for every 300 square feet of space. That, by the way, is the model we're using now in grocery stores for the hours that accommodate seniors. Every staff member who works the retail operation and every customer will need to wear a cloth face covering. You'll notice on the screen there's a barrier between the cashier and the customer, which is what you see now in most grocery stores. And we're encouraging retailers to make it easy to either pay in advance or to use a contactless payment system in the store, because we want to make it quicker. We don't want you lingering in stores and browsing for a long time, and frankly, we just want to cut down on personal contact. I know this is going to be hard for retailers. Some of you may not be able to open with such limited capacity, and I want you to know we're going to work hard to get into phase 2, where we can relax these restrictions so everybody can open. If you're confused about, if you just need guidance, you can call the Department of Business Regulation. You can call the Commerce Department, and we'll try to walk you through it. I hope the visual helps. All of this is going to be online later today. But come a week from today, assuming I've lifted the stay-at-home order, if you're a retail operation that can comply with these new rules, go ahead and open your doors, and let's get your sales going again. I want to take a second to talk about restaurants. Restaurants, as I said last week, are not really going to be opening in phase 1. Having said that, opening a restaurant is complicated, and we've been having many, many conversations with restaurants, big and small, and the Hospitality Association. So I want to give you a feel for how we're thinking about it, what you can expect in phase 1, and where we're going with phase 2. It goes without saying that restaurants, like retail, have just been crushed all over the country. And so this one looms heavily on me to try to figure out a way to get you back in business. So maybe you could put up the restaurant photo. So, and I'm putting this up because restaurants are going to have to do a lot of thinking now in order to be able to reopen down the road. On the screen is a mock-up of what a restaurant might look like. As you can see, the inside of the restaurant is entirely closed, except for people coming in for pickup orders. So that's phase 1. That's what we intend for phase 1. We're not in phase 1 intending to enable in-store dining or in-room dining. We are hoping to help accelerate some of the takeout options, and Commerce will have detail around that. Like retailers, we're also encouraging restaurants to make it easy for folks to do curbside pickup. Now, for those that have the capacity to do outdoor seating, we are hoping to be able to enable that into phase 1. Not Monday, wait for another announcement, but into phase 1. And as you can see from the drawing, tables must be set up in a way that ensures social distancing. Seating will be by reservation only, and there likely will be no frequently touched and reused objects. So think of a menu, condiments, silverware will all have to be individually wrapped. Staff will have to be wearing masks. So it's a very different form of dining than we're used to. I also know not every restaurant today is capable of doing outdoor seating, and I'm fully aware that some of you may just skip phase one. Having said that, I would encourage you now to get creative. Maybe you don't have an outdoor dining area now, but maybe you could convert part of your parking lot into outdoor dining. That satisfies all of these requirements. So start thinking now to get creative, and we are going to continue to work with you. Our Commerce team and our Department of Business Regulation team wants to work with you. We're also in constant contact with mayors and town managers. They want to work with you. We want to enable outdoor dining to start in phase one for as many restaurants as possible. Dining and other kind of close in contact businesses, salons and the like, will definitely be the focus of phase two. To remind you, assuming things go well, phase one is probably 14 days. And then we move to phase two. I want to take a minute to talk about office-based environments. So I will begin by saying thank you. When we started this, offices were, many of them worried, how will I be able to do this? And you've done an amazing job. Most of you are working from home. Most employers have enabled people to work from home and continue to get paid. You're using Zoom, you're using teleconference capabilities, you're using different kinds of technology that you previously hadn't used. And it's been inspiring and incredible for me to see the speed with which you've adopted your businesses to enable people to work from home, and I want to thank you for doing that. As a reminder, if you're a small business or a small retailer and you're still struggling to sell things online, set up a website, enable e-commerce, enable people to work remotely, please call 521-HELP. It's the Commerce's Help hotline, and we still have available free technical assistance for businesses who need a hand adopting your business for remote working or for any kind of new technology. Okay, so during phase one, if you can work from home, you should still work from home. And that's really most people. Lawyers, accountants, HR workers, financial folks, software engineers. Most of you can work from home, and you should still continue to work from home. Some of you, maybe you cannot work from home and you work in an office, and so you folks can start to come back to work in your office. Also, I understand if you can work from home, there's reasons that you need to be in the office. Maybe you have to get together with a colleague, maybe you have to have a meeting with your boss, maybe you have to get your software updated on your computer, you left some papers in the office, you have to pop in and collect some materials. I would say, that is fine. What's not fine is returning to normal right away. Remember, go slow, go steady. Not fine is returning to normal right away. Not fine is if you have a job that you've been doing at home for a month, perfectly fine. You should not automatically start going to the office every day. Not in phase one. In phase two, but not for these next 2 weeks. Please. Not fine is congregating in the office. Still 6 feet apart, wearing your mask, washing your hands at all times. So part of my decision in going forward before some of our neighboring states is that phase one is slower and more limited. And that means, if you've been working from home, it's inconvenient but fine, I'm asking you in phase one to keep doing that. And if you're hearing me say this and you run a bank, a law firm, an accounting firm, a financial institution, the state, I'm asking you to let your employees continue to work from home for phase 1 for 2 more weeks, with limited exceptions to pop into the office sometimes, as I just explained. I think we have an office chart as well, if we could put that up on the screen. Workplaces are going to have to adopt new safety standards. None of this for the next year is going to be back to normal, what we think of as normal. So, and we're all going to have to continue to do our part to keep other people safe. All workplaces should start to think about this stuff now. That's why I'm making announcements today, a week in advance, so everyone can start thinking about it. It means I want you to start thinking about developing staggered work schedules. Let folks work in shifts or in pods. Remember, we want to limit our network. We don't want to be seeing a lot of different people every day. So stagger your work team so you're in the same team on a daily basis. Every employer is going to have to screen every employee every day to make sure they're not sick, and they're going to have to require people who are sick in any way with any symptoms to stay home. Common spaces like break rooms should be closed, and every accommodation should be made to keep people 6 feet apart. In a conference room, 6 feet apart. It also means you need to start thinking about more frequent cleaning and having the necessary supplies and frequent cleaning of desks and chairs and such. A lot of businesses are saying, assigning a desk to someone. This will be my desk and my pen and my chair for the next month. And it must be cleaned regularly. I will be back later this week with some more details around which of these are guidelines and which are these are enforceable, for lack of a better term. And we're going to have a whole day this week dedicated to just that. But for now, I wanted to give you a flavor of what phase 1 might look like. So phase 1 looks like being able to go to a shop and pick up some things, do a limited amount of browsing in retail. Looks like popping back into the office on occasion if you need to. At the end of phase 1, maybe we can go out for dinner outside. And all looking forward to phase 2 when we start relaxing some of these requirements. In addition to retail, where we've lost a lot of jobs and where we think it's safe to reopen, we are also going to be focused in phase 1 on getting a lot of our healthcare workers back to work. So you have heard me every day thank the many healthcare workers who haven't had a day off, and there are many, many of them in nursing homes, in hospitals, in other settings. Having said that, we also have many, many healthcare workers who are out of work because hospitals have stopped non-critical procedures, elective surgeries, dentists have scaled way back, on and on. Even primary care, people are afraid to call their doctor and go see their doctor. So to that point, we're also going to be leaning in phase 1 to getting a lot of healthcare folks back to work. In phase 1, anyone who has deferred healthcare needs, which by the way is a lot of people, if you've deferred your immunization shot, deferred a well visit, deferred a specialty care visit, we want you to pick up the phone and call your primary care provider and go ahead and set up appointments. We want you to start getting back out there. It's very important to keep yourself healthy. So if you've been deferring seeing your doctor, it's time to get back out there. In the first instance, call your primary care provider and go ahead and start to set up appointments. Telehealth is being increasingly used. It's also being paid for by insurance companies. It's still a great option. So continue to use that. But you can't get an X-ray with telehealth. You can't get an immunization with telehealth. You certainly can't get elective surgery with telehealth. So we are going to start relaxing a lot of the requirements for our allied health professionals and other health professionals and specialists and doctors in phase 1. Specialty providers like orthopedists, neurologists, cardiologists are open. They've remained open, and we're going to encourage you to start going to see them more during phase 1. Certainly, time-sensitive or emergency procedures at the dentist's office are continuing to happen under new safety guidelines. And certainly, if you have an emergency, please go to the emergency room. We're also working with our hospitals to enable them to start reopening for elective procedures and elective surgeries. Later this week, I hope to have specific announcements around which hospitals are coming back on which days, but I'm previewing for you that in phase 1, we want to start to see a lot of our healthcare folks get back to work under all new infection control plans, mask wearing, et cetera, and to allow people to start getting the health care that they've deferred. And there will be a lot more guidance in more detail this week from the Department of Health as it relates to specific specialists and what you might expect. But for the average Rhode Islander, just know that if you've been putting off health care, call your doctor, because in phase 1, we're going to be enabling you to get out and see the doctor. Finally, I want to make a special note about visitation to nursing homes, hospitals, and assisted living centers, and sadly say that we will not be allowing any visitation during phase 1. Now, I say sadly because I think that's really tough. Mother's Day is on Sunday. A lot of us haven't seen our loved ones for 2 months. We used to see them every day. Now we haven't seen them in months. However, if we know one thing about this virus, we know it is not kind to those who are frail, to the elderly, to people with underlying health conditions. And so at the same time that we're going to be slowly allowing people back to work because we have to get commerce going, we unfortunately have to double down on our efforts to keep the most vulnerable among us safe. So in phase 1, we will not be allowing visitation to hospitals, assisted living, or nursing homes. And I'm saying that now because that's very hard, and I'm asking you now to make plans. To make your plans now around how you're going to continue to stay in contact with your loved ones without actually being able to see them. So that was a little bit long. I apologize, but it was a lot of information to get out. We'll have a PowerPoint online later today. If it's not already up there, we'll have pictures. And throughout this week is going to be a lot more detail with specific regulations and also technical help. Let us give you a hand. Call Commerce if we can help you. As I'll end by saying, we're going to have to be flexible. We're going to have to be patient. We're going to have to work with each other. And I am completely confident that we're going to stand this economy back up in phases and keep Rhode Islanders safe in the process. So with that, I'll turn it over to Nicole.
Thank you, Governor. Good afternoon, everyone. Thank you for joining us today. To the Governor's credit, with her leadership, a tremendous team of people have been working together to provide these phases for reopening the economy slowly, cautiously, and letting it be so that we can return to a different approach at accomplishing what we were doing safely. And I'm honored to be a part of the public health guidance based on science, based on our data, to help lead that and fulfill that process. So I want to thank Dr. McDonald for filling in yesterday. I know that's something that many of us appreciate and enjoy watching. I'll begin first with the data. We have 175 new cases. Of our COVID-19 patients, 339 are currently hospitalized. Of those people, 84 are currently in the intensive care unit, and 61 of those 84 are on ventilators. Sadly, as the governor has mentioned, we have 21 new COVID-19 associated fatalities to report. It is important for us to acknowledge that our thoughts, prayers, and deepest condolences are with the families of those who have passed away. To share a little more, these people range in age from their 40s to their 90s. One person in their 40s, two people in their 60s, and one person was in their 70s. Most of our unfortunate fatalities are among people in their 80s and in their 90s. 8 of the people who passed away were in their 80s, and 9 of the people who passed away were in their 90s. So, to move a little bit further into what reopening the economy is going to look like and what's needed to help ensure that everyone feels safe as we take these steps cautiously and steadily. We have been talking about the comprehensive approach. We've seen from our data and the modeling that was shared on Saturday that the social distancing measures and our comprehensive approach can be effective in shifting the steepness of the curve and flattening it. We know that social distancing, the 6 feet apart, is important. Everyone wearing their masks is important. Access to hand sanitizer and washing your hands, all of that is important. As we move forward, we'll want to really rely on those critical elements that we know make a difference. The other part that we have spoken of that's important for going into phase 1 is the robust testing program that we have that allows us to identify people, get those who have COVID-19 isolated effectively and safely, and contacts of those people, get them to be quarantined. That separation is what allows us to stop the virus from being transmitted from one person to another. So the testing piece is one element of this comprehensive toolbox that allows Rhode Island to stay in front and to present an opportunity for you and all of us to feel safe going out. Our testing approach has 3 major components, and I've already shared with you the first 2. We know that we have an expanded testing program that's really focused on testing everyone who has symptoms. Our focus is to get all of those tested with symptoms within 48 hours. And we continually look to expand the number of sites and mobile testing capabilities for our high-risk and high-need populations. It's what's going on at the CVS site, it's what's going on at the other drive-through sites, and the walk-through sites that we've talked about in the various communities across Rhode Island, focusing on people who have symptoms. The second major approach for our testing is also something that you are aware of. It's our rapid outbreak response. I went into that in depth when I shared about our nursing home response, how comprehensive and aggressive we are. If there is one positive case, we can go into a specialized setting like a congregate setting, a nursing home or a group home, and test not only the one person who had symptoms, but the folks around that person who may not have symptoms but were contacts or who were in the facility, more so that we can understand what's going on in that environment and rapidly respond to the cluster of cases that's there. That's also going to be a critical step for us going forward, being able to go in quickly, do comprehensive testing, get people into isolation and quarantine, and make sure the appropriate infection control steps are in place. The third major area of our testing strategy is going to be being able to test people who are just in the community so that we can better understand how coronavirus, COVID-19, is impacting people in all elements of our community, in our workforce, in our retail, in other settings, and then be able to rally around that and have a response that allows us to continue to keep people safe, getting them into our contact tracing program, getting them into isolation and quarantine effectively. So I'm going to continue to share more in the coming days about this third expanded type of testing, but want to get started with just giving you a taste for today. One of the things that we are going to be doing with that third approach is testing at places where workers are still interacting with a lot of people face to face. The more we can understand about that, the better we can be in our response, and the better data we can have about how to go to the next phase safely. So for this element, we have worked with leadership of 4 Stop and Shop sites locally across Rhode Island, and we're going to be giving their employees the opportunity to, if they want to, get COVID-19 tests. The tests will be the traditional PCR diagnostic test and an antibody test that will allow us to understand more about how those tests work together. I want to reiterate that testing for those employees will be voluntary. Something else for people to understand is that you cannot just go to Stop and Shop and expect to be tested as the customer going there. The focus for this approach is an opportunity that's opened up to employees only at this point to help us better understand. Our vision here is to use specific, representative samples of people and places to understand how much disease is in the community and get more information about how it can be transmitted so that we can have a better approach for the state as a whole. We do something similar to this every year with the flu. When we report out every year on what kind of flu season we're seeing, what we're doing is sharing estimates of how the entire state is being impacted based on some targeted representative sample testing that we did in specific locations that are generally reflective of Rhode Island throughout the state. Again, as I said, we'll continue to share more about this in length tomorrow on our plans for testing going forward, including how this fits into all portions of our strategy to make sure that Rhode Island is safe for everyone as we are reopening the economy. But wanted to make sure that you had a taste of the steps that we are moving quickly forward with so that we can gather the information, and as a Rhode Islander, you can be assured that we have a strong public health founded approach to how we're going forward, collecting the data and making decisions based on that information and science so that as we're reopening the economy, it's being done safely and effectively.